It's Medicare Monday on Community Connection. Mike Hitcho of Hitcho Insurance Agency is here to tell us about the differences between Medicare Supplements and Medicare Advantage plans. Thank you so much for being here, Mike.
Thank you, Liz. I appreciate it.
So again, this is a pretty big deal. If someone's trying to decide between a Medicare Supplement versus a Medicare Advantage plan, please describe both of those and explain what they do.
Sure, yeah. This is very detailed information, but let's first acknowledge Medicare leaves bills behind for services that you would use, okay? So how you want to cover those bills is up to yourself. If you purchase a Medicare supplement, the Medicare supplement insurance carrier is going to cover those bills, potentially in full, okay? Maybe you might have a small deductible left behind, okay? If you pick up a Medicare Advantage plan, those plans are not designed to cover all of those services in full. You're going to have some co-payments left behind. Depending on your plan, maybe a deductible or something called co-insurance. Kind of like group health insurance that you might have had for while you were employed working.
Right. So what are the pros and cons, would you say? What do you tell people of Medicare Supplement?
Yeah, what we see at Hitcho Insurance Agency, a lot of people always, they have this question, okay? Basically, the pros to having a Medicare Supplement are you know what your monthly cost is, okay? You have a premium for the plan, that's what you're gonna pay monthly, and then you know it's covering all your bills left in full. The con is, if you're not using the insurance a lot, over time, that monthly premium really adds up. And if you and a spouse is on coverage, times two, that could get really expensive over time.
Interesting. What about the pros and cons of a Medicare Advantage plan?
So the pros to the Medicare Advantage plan, they're going to offer additional benefits like dental insurance, eye care, some over-the-counter, money for over-the-counter potentially items, and a low cost, sometimes no cost. Maybe even some money going towards the cost of your Medicare Part B premium. So it's way more affordable monthly. Now the con is going to be if you're diagnosed with something, you have bills that you're going to be responsible for those services. Now what we see, some of the larger bills are going to be associated usually with somebody who is getting a Medicare Part B drug, a drug administered at a doctor's office or outpatient at the hospital, maybe like a cancer treatment, a chemo or radiation. You're going to have 20% of the cost to pay, all right?
So this seems like a big decision for somebody to have to make. What should someone do if they would like, your agency to help them out? Because again, you're explaining this so well. I would love to be sitting in a conference room with you just explaining this. What can people do?
Yeah. So we break all this down and make it very simplistic for somebody who is new to Medicare, or even if they're on and looking to change plans. We're going to review your situation and then make a tailored recommendation that's going to suit your needs.
Mike, thank you so much again for joining us on Community Connection.
Thanks, Liz.